Fuck this whole goddamn administration, dude. I just got my healthcare taken away from me. I'm a 100% disabled veteran. I got a partial part of my fucking healthcare taken away from me because of Donald Trump and his goddamn cronies. Thank you. Thank you so goddamn much. Thank you. I'm gonna be in fucking pain for weeks again because I can't get the goddamn healthcare that I need. They took away my fucking healthcare. Are you listening yet? They don't give a fuck about American people. They don't give a shit about veterans. They took my fucking healthcare. I'm a 100% disabled veteran and they took my goddamn chiropractor, you guys. The only thing that gives me relief for my broken back. The only thing that gives me relief. They took it away from me. They say I live too close and now community care is no longer available to me. Even though the VA is so understaffed, they cannot get people in when it's actually necessary. They can't get people in because they're so understaffed. Thank you. Thank you so fucking much for voting for this shit. Thank you. Thank you. I hope you have fucking veterans in your family that shame on you. Shame on the MAGA people. Shame on this goddamn regime. Are you fucking serious? I can't get my goddamn healthcare, but billionaires can get more fucking tax breaks? Awesome! That's fucking awesome!
Whenever the government cuts Medicare or Medicaid, disabled people get kicked off the programs that keep them alive. Because we are the waste that they are talking about. Our continued survival is something they consider fraud. Even though the federal government says that most overpayments are a result of administrative error or incorrect documentation rather than intentional fraud. Sure, maybe there are some people out there that are committing fraud. But if you are so committed to crackdown that you're okay with disabled people being your collateral damage, that's just eugenics.
That was what I had to do, go to the emergency room and pay the bill somehow, some way.
Wait, how do you have health insurance?
How do I have health insurance?
Yeah.
I pay for it.
So is it through your employer?
Through the state. I'm also on Medicare.
The Trump administration wants to defund it. Yes.
Right. I don't believe it. There's no evidence of that.
Well, he did it already. The big beautiful bill defunds Medicare.
Oh, really? That's why I'm still on Medicare.
Yeah. It's gonna defund it after the midterms.
Really?
Yeah.
Okay, we'll see when that happens. Because I'm still paying for the service. It's not free.
I'm aware. I mean, but
They take it out of your Social Security check.
I want you to get Medicare. I want people to get Medicaid. I want you to be able to live in dignity for the rest of your life. And the Trump administration is actively trying to defund the things that you need to live.
I don't believe that.
And it's going to kick in after the midterms.
I don't buy that, and we'll see what happens. You're looking into the crystal ball.
I'm going to put like a little blurb right here showing what the big beautiful bill defunds. Basically, it's going to go right here.
Right.
So
you can prove that I'm ignorant, but that's okay.
Go right there.
I don't believe you. I don't buy it. I know you're a left-wing liberal, and a lot of things you say are kind of like slanted.
How about this? We see each other at MAGA events repeatedly.
Right.
Can you make a commitment that you're going to look that up?
I certainly will.
Once you've looked that up, you can come back to me the next time you see me.
Yes.
And you can say, hey, I looked it up. Let's go over the nuances of that, right? And then we can have a proper discussion on that.
All right.
Thank you.
Walter, it's been a pleasure.
Thank you so much.
I want to just go over what happened with that letter I got yesterday about my Medicaid. I had no idea that my account was they called it a review. However, when I logged into my account online last night, it said that I did not need to reapply until February of next year. So when they tell you that these Medicaid cuts are not going to happen until the end of next year, they're full of shit. Just so we're clear, they are reviewing people's accounts and kicking people off Medicaid right now. And I know this because I'm one of those people. So if you are on any of these programs and you have access online, if I were you, my best advice to you would be to always log on and look and see what's going on with your account. I had no idea that a new application had been submitted for me because I did not submit it. I don't need to until February, but they've already kicked me off the program. So, and my son, who was a 19-year-old high school senior, they have put him on his own account as an adult. He is also autistic, and his Medicaid ends October 1st. So there you have it. There you have the big, beautiful pile of shit bill in a nutshell. And if this is going to happen to millions of people, and it has already started. Thanks, MAGA. This is what you voted for.
MAGA thought Medicaid cuts was only going to affect the people they don't like, and that's how they voted against their own interest. They were told Medicaid cuts was only going to hurt immigrants and black and brown people, and they forgot that they also need these programs more than the people they were told to blame. So let's get to see more. Please like and have the video, and let me know that's in the comments, all right?
I saw this circulating yesterday, and I wanted to look into it before I shared it. So here you go. If you are on Medicare or on a fixed income, I just need a couple minutes of your time. I'm actually sick to my stomach after reading up on this bad news. And this is bad news that's going to hit your wallet come January 2027. This is an attack on seniors. The Trump administration announced they're going to cut a Medicare Part D subsidy program. This is absolutely abhorrent. This is devastating for millions of seniors who are on fixed incomes and who are struggling as it is. Experts are saying because of this administration's decision to cut this program, private insurance companies are going to hike up their monthly premiums. They're estimating 45% of our seniors are going to face premium increases in January. And if you've ever struggled a time in your life, trying to make that dollar stretch is between life and death. But I should clear something up so that there's not a mass panic. They're not canceling the overall Medicare Part D. That $2,000 annual out-of-pocket drug cap, it's still there. Your medications will still be covered. It's the monthly premiums that will increase. The subsidy program is what they're cutting. Like I said, this doesn't hit until January of 2027. So if your income is limited, apply for Medicare's Extra Help program right now. When open enrollment hits, go and find the cheapest plan in your area. And I just saw that some states have state pharmaceutical assistance programs that will help pay premiums for you. And just a reminder, Dr. Oz and his team has cut this funding because they've stated that market conditions have stabilized. What? These are our seniors, the people that we're supposed to take care of. What exactly are you guys going to do with that $3.6 billion funding if you're not going to give it to the seniors?
My mom's Medicare was giving her a shot every month in her eye to keep her eyes healthy and keeping her from losing her eyesight for her to be able to see. But since Trump was in office and he cut so much shit, he cut her Medicare off. So now my mom is going blind. My mom is going blind because Trump cut the Medicare. Don't ask me how I feel. Fuck this fucking country. Medicare was paying like almost $9,000 or $10,000 a month for my mom to get the shots in her eyes. But since they cut it off, now she has to pay $5,000 a month. And I think that's for each eye. So I don't know if it's for each eye or just one session, but it's a month and that's very expensive. Like, I don't know what we're gonna do, but I really hate that my mom is going blind and she won't be able to see me or my kids again real soon. Like, she has 30% of her eyesight, and if Medicare don't find any programs to help her, she's gonna go completely blind.
Big beautiful bill Medicaid cuts. I'm for it because I'm an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. I'm good with that. I'm not an immigrant that I can't prove my citizenship to.
Jiggy, Jiggy, I don't think you get how things work. Not surprised, since you are part of the undereducated crowd. You're part of the crowd that we can't even call CUNTs because you lack depth and warmth. I also work 40 hours a week, and I have like 5 degrees, and I've lost count of how many certifications I have. Hon, do you know that not just people who are on Medicaid actually benefit from Medicaid? I don't know why I just asked that. Clearly you don't know. Medicaid funds hospitals, clinics, and community health programs. A lot of emergency rooms are funded by Medicaid. When twat waffles like you vote with your hate instead of doing any research at all, this is what happens. From the bottom of my heart, I truly cannot wait until you and your family are also affected by the Medicaid cuts that you think have absolutely nothing to do with you. And even if that was true, you're just pointing out why I can't call you a CUNT. No depth, no warmth. The JJs even have more brains than you.
As a physician that takes care of Medicaid patients every single day, I want to talk a little bit about the bill that was passed yesterday, what it could mean for people like my patients, and what it could mean for the overall healthcare system. This bill specifically is going to require Medicaid patients to have strict work and reporting requirements in order to maintain their coverage. Here's what I see every single day. We have people that are recovering from surgery. You have patients with chronic diseases. You have people that are caring for family members that are ill. They just can't go to work to clock in. They can lose their coverage not because they're not willing to work, but because life just isn't sometimes that simple. Here's the biggest part of what you need to understand. If these patients lose coverage, they're not just going to disappear. They'll have to wait until their symptoms get worse, and then they'll show up in the emergency room. Not because they want to, but because that's their only option. That means diseases are going to be caught too late. Patients are not going to have access to medications they need, and there's going to be preventable emergencies. We already see this, but it's going to become more and more common. Here's the part that most people don't realize. When millions of people lose healthcare coverage, the entire system is going to feel it. So hospitals are going to take on more unpaid care. The costs are going to have to go up. Don't vanish. They show up in higher premiums, in overcrowded emergency departments, and limited resources for everybody. When one group loses access to coverage, we will all feel it eventually. This isn't about politics. This is about people. What we need are policies that are going to strengthen access, support prevention, and value long-term health.
Hey, well, he's getting rid of Medicaid. And here in this very poor, very red state that I live in, Medicaid is under a program called TennCare. That's our version of Medicaid. And it's 65% federally funded. So when that money's gone, a bunch of you all are going to be dropped from TennCare. I hope they keep kids covered. But the rest of you, you're going to be in my world. Either you're going to have to pay for coverage or you're not going to have insurance. And you just hope you don't get sick. Yep, I've listened to you sing the praises of Trump while getting your TennCare. I've heard you talk about Biden while you got your TennCare. Well, to use one of your all's favorite little sayings, you're getting ready to find out.
Are you ready for your local hometown hospital, your nursing homes where your loved ones live at, to close down? Are you ready to lose your job that you've had for decades? Well, guess what? Because this big, beautiful bill has been passed, not only are millions of Americans losing health insurance, but hospitals, nursing homes, and other medical entities rely on Medicaid payments to stay alive. This is the largest healthcare cut in U.S. history. So geez, I'm really sorry. I hope you can find a place for your grandma, your grandpa, your mom, your dad, your sister, your brother to live. Honestly, I just hope that if you did end up losing your critical access hospital in the middle of nowhere to these cuts, that somehow you can survive the extra 30, 45, 60 miles away to the next hospital. You can thank your politicians, the Republicans, Congress, and President Trump for that. And if you're about to be upset that, gosh, Emily, I hate that you're being political, Healthcare has always been political. I grew up in a Republican town with a critical access hospital, and I'm proud of my roots. But honestly, these politicians don't care about your healthcare, and they don't care if you die. All they care about is saving money, even if it's at the expense of your life and your loved ones.
I think many MAGA voters didn't realize that policies once implemented, they don't only affect the people they don't like, they affect everybody. But some are so filled with hate that they don't care about the personal outcome as long as it negatively affects someone else. Rural America relies on Medicaid to keep their hospitals open, and almost every family has got one person who relies on Medicaid, but that did not bother them at all as long as it was going to hurt someone else. You see, this goes down to racism, and racism is very expensive. And most of their politicians, they spend more time convincing them that their biggest problem is immigrants and black and brown people, and that's a very powerful political strategy, because if you can convince people that someone else is responsible for their struggles, they stop asking them some difficult questions. Why are my groceries expensive? Why can't I afford healthcare? Why is housing so expensive? Why can't my wages keep up? Why is my community losing hospitals? You see, culture wars make people feel like they're defending their identity, their religion, their community, their race, their values, or even their tradition. And once politics becomes more about identity, facts become more harder to accept, because admitting that a political decision is hurting you may feel like admitting that your political team was wrong, and people do not want to admit that. They would rather suffer with a political side that admit the other side had a point. And the Americans need to look beyond the culture wars and start looking at their shared interest, because above the political argument, all ordinary Americans, they want the same basic needs: cheaper groceries, affordable healthcare, good jobs, and to retire with dignity and to have opportunities for their children. So thank you so much for tuning in. Be sure to like, subscribe, and share. Have a good one. I'll see you in the next video.